Hello, today I'm going to talk to you about attention deficit or hyperactivity disorder. This is a chronic condition, involves the patient has difficulty paying attention, always hyperactive and very impulsive. It can be caused by an interaction between genetics and environmental diseases. There are a number of factors that could contribute to this disorder. There's genes, cigarette smoking, alcohol use or drug use during pregnancy, exposure to environmental toxins like high levels of lead at a young age, low birth weight, and brain injuries. It begins in childhood and can persist into adulthood. It may contribute to low self esteem or troubled relationships and difficulty at school or work. The warning signs in adults, people with ADHD have got an ongoing pattern of three types of symptoms: difficulty paying attention, being overactive, hyperactive, and acting without thinking. That's very impulsive thinking. These symptoms get in the way of functioning, of development. People who have ADHD have combination of these symptoms. They overlook or miss details, they make careless mistakes at work or during other activities, and they have problems sustaining attention to tasks or plays or conversations, lectures, or lengthy readings. They seem to be not to listen to what other people say and talk directly. They fail to follow through on instructions. They fail to finish jobs or projects. They have difficulty organizing tasks and activities, each and six things. They avoid or dislike tasks that require sustained mental effort, such as projects. They lose things which are necessary for tasks, such as supplies, pencils, books, tools, wallets, keys, paperwork, eyeglasses, and cell phones. They become very easily distracted by unrelated thoughts of stimuli. They are forgetful in their daily activities such as chores, errands, returning calls, and keeping appointments. The signs which I have noticed with patients with hyperactivity, always fidgeting and squirming while sitting, getting up and moving around in situations when they need to be seated or expected, running or dashing around in situations, being unable to play or engage in hobbies quietly, being constantly in motion on the go or activities driven by a motor. They talk non-stop, blurting out an answer before a question has been completed, finishing other people's sentences or speaking in turn, having trouble in waiting for their turn. There is no cure for ADHD for this condition, and current available treatments may help symptoms and improve functioning. It is commonly treated with medications, education training, and I use a combination of therapy. For medication, the psychiatrist has to be involved, and the involves reducing hyperactivity and impulsivity. The first line of treatment is stimulants. This may seem unusual to treat ADHD with a medication that is considered stimulative effective. Most researchers think that stimulants are effective because the medications increase the brain chemical dopamine, which plays an essential role in thinking. Then you can also use non-stimulants. These take a longer time to get working than stimulants, but they improve focus and attention and impulsivity in a person with ADHD. Doctors may prescribe non-stimulants if a person has bothersome side effects from stimulants, while the simple stimulant is not effective by itself. Antidepressants, against this is only the psychiatrist issue who is supposed to prescribe them, and it are used sometimes to treat patients with ADHD. Older antidepressants are called tricyclics. Sometimes they are used because they are stimulants, they affect brain chemicals, norepinephrine and epinephrine. There are many different types of antidepressants, all which have potential benefits. Some several medications and dosages must be tried before one is worked properly. You have to monitor and keep on changing the dose. Anyone taking these medications has to be monitored carefully and very closely by the doctor treating them. Then there's the support therapy, which is what I like using. This is a kind of where I use two basic methods. I mean, three or four. One is support group where people sit down together and they share their experiences with similar conditions, and then we can talk about cognitive behavioral therapy, and there's talk therapy, whereby modifying focus on modifying negative thoughts, behaviors, and emotional responses associated with psychological distress. Anger management. This is for people who get anger very fast. Practicing mindfulness, coping mechanisms, and trigger avoidance so to minimize destructive outbursts. And of course, finally, there's counseling psychology, which I use, whereby you treat the personal problems as related to school, work, family, and social life. There is also family therapy involving the families. This is to resolve conflicts between members of the family. In conclusion, I have to say ADHD is a disease without a cure. It has a serious and long-standing impact on a person's life. This means that for most people, ADHD symptoms will never completely go. But most people manage 90 to 95% manage their symptoms effectively. They improve the quality of their life. If you have any questions, you can kindly prescribe to me. I'm at rajishori.com or on my mobile telephone number 07896855034, and I will be willing to give you the necessary suggestions and advice. Thank you, ladies and gentlemen.